Welcome back to the show, everybody. Today, our guest is Lori Casselman, founder and CEO of June Health, a digital health platform dedicated to supporting women through perimenopause and menopause. Lori dives into her own personal experience and explains how she is leveraging her deep healthcare experience to revolutionize the menopause experience for women everywhere. I hope you enjoy this conversation. Thank you for joining me, Lori. I really appreciate you taking the time. And I'm looking forward to just hearing what you have to say and getting to know you a bit.
Yeah, absolutely. Thank you for having me.
No problem. So obviously we're going to be talking about perimenopause and menopause, just given that your company, June Health. But maybe if you could just describe, your experience with menopause, perimenopause, what you kind of struggled with for years, and if you could just walk us through that personal experience, as well as what you think about the menopause gap, and just describe that a little bit.
Yeah, absolutely. So let me start by saying that my care journey and my sort of journey through midlife, perimenopause, and menopause is definitely not unique to me.
Hmm.
And I have learned that, I would say, in spades by talking to many women over the last few years as we've been building June Health and really getting to know our member and practitioner communities. And the other thing I will add is that this sort of journey through midlife is definitely not a linear one. And that
Hmm.
was absolutely the case for me. And so for me, what really, my experience looked like was as I got into my early 40s, you can imagine just to sort of set the stage, I'm a busy working professional. I have two kids who are now sort of in their early teens. And I just started to experience a number of symptoms that were unusual for me. So
Hmm.
I've been pretty active my whole life. I eat a pretty healthy diet. I would say I have a generally good level of stress management.
Hmm.
And what started to happen is, I was unable to sleep properly for a period of close to a couple of years. And so, not sleeping very well started to relate to general feelings of fatigue and, sort of lack of motivation, which had never been a problem for me.
Yeah.
A lot of sort of stomach discomfort and some irregularities in my menstrual cycle. Um, I would say also just general sort of changes in my mood and this general feeling of something being off and not quite feeling like myself. And I have a fantastic family physician. We've been with him for a number of years. And so my first, sort of line of contact was to go back to him. And, I kept sort of going back when I could find the time. So anywhere
Yeah.
from, call it 6 to 9 months to a year of like repeat visits. And this is over the course of, I'd say, probably like 5 to 7 years, right? So I'm going back, I'm getting blood testing done. We were almost treating like each symptom in isolation, and he would
Hmm.
send me for tests. And, I did blood work, I did lab tests, I did a number of different diagnostics. And ultimately, it all just kept coming back with unclear answers. So there wasn't any one thing that he could point to. There was, I would say, a lot of feeling a bit dismissed when I would come back from these appointments or we would get these results, and attributing things to stress and changes in my lifestyle and perhaps, change in the family dynamic or change in my eating habits, which I knew was not the case,
Yeah.
right? Nothing was really changing, but
Hmm.
these symptoms just continued to appear. Eventually, I went to get an executive medical. So, I was fortunate to have an executive medical through my employer. And what I will also say is I still had very unclear answers, even with a very, frankly, high cost, very comprehensive executive medical, still had very unclear answers. And for me, it wasn't until I found a women's health expert who had menopause certification that it became abundantly clear that this was just perimenopause. Very common, you know, all women will go through this stage of, sort of perimenopause leading up to menopause. And there are over 40 common symptoms. All of those symptoms I was experiencing
Hmm.
fit in that bucket of 40 common symptoms. This stage begins for women as early as your late 30s, early 40s. So I was squarely in that stage.
Yeah.
And yet those dots were not being connected, even though those symptoms directly correlate to these perimenopause symptoms. And I was right in that age range. The dots weren't being connected. And for me personally, I thought I was way too young to be anywhere near kind of menopause stage. So I wasn't connecting those dots. And the bottom line is, if you can connect directly to an expert, there's a very clear connection and line to this is what you're experiencing and this is how we can treat it.
Yeah. Wow. And I guess you said every 6 months to a year, like you'd be going back to your original doctor. Was there not even a mention like once of menopause or perimenopause?
No mention of perimenopause. And when I started to do my own research and ask questions about menopause, when it sort
Yeah.
of, I had a bit of an aha moment where I was like, okay, hang on, could this be menopause? The response I got was that, and frankly, I was asking the question around could this be menopause because I was looking to get treatment clarity. What can I
Mm-hmm.
do about this to get these
Yeah.
symptoms under control? And the response that I received is, you're not clinically defined as being in menopause until you've missed 12 consecutive periods. And therefore, there is no sort of prescription or medication option that I can provide to you until you hit that clinical definition.
So they
And
just waited out. Yeah.
and it's a little bit of a just wait it out and
Yeah.
sort of grin and bear it or power through.
Yeah.
And now with years of experience and access to clinical experts through the building that we've done with June Health, it's even more frustrating to look back at that because now what I realize is there are very common, easily, sort of accessible treatments that change everything.
Mm-hmm.
And when I finally saw that expert practitioner myself and got access to a prescription for hormone therapy, within weeks, all of those symptoms were gone.
That's incredible, but crazy that you had to wait that long.
And it's not unique to me,
And
right?
now so many women experience that, right?
Absolutely. I mean, every woman will go through the stage of change
Yeah.
where, they sort of hit that menopause clinical definition. It's a
Do you,
hundred.
do you do you think in our current medical system, is it a lack of training in menopause? Is it that they're, discouraged from, giving these treatments? Like what do you think the reasoning is?
It's primarily a lack of training. I would say that's the foundational challenge. Only 7% of primary care physicians self-report that they feel adequately trained to treat women during perimenopause and menopause. It's less than
Wow.
2 years of training that they would receive during medical school on sort of reproductive and menstruation and menopause related treatment.
Yeah.
So that's the first piece. The second piece is, there was a very large study done on hormone replacement therapy, which is, what it was referred to at the time.
Hmm.
We now call it menopause hormone therapy, MHT. But at the time when the studies were done, there were a number of flaws in this very large longitudinal study that was done. And some very early conclusions were made that correlated that treatment to increased risk for certain reproductive cancers in women.
Hmm.
And so this was several decades ago, but the long-standing effects of that, sort of poorly concluded and highly picked up set of results actually created a very long-standing effect where physicians were resisting
Hmm.
prescribing that type of therapy to women. And there was a lot of, I would say, like sort of fear mongering around that type of treatment. We now know several years later, and or I should say several decades later,
Yeah.
with a great deal more research and awareness building, that the risks are minimal, and in many cases, there's actually really positive impacts on other areas of your health, bone health, mental health, etc., with beginning that type of treatment earlier.
Yeah. And it's remarkable because estrogen is expressed everywhere in the body.
Right.
So digestion is affected, your cognition is affected, Bone
Exactly.
density is affected. Every system that has estrogen receptors is affected.
Absolutely. And we
Yeah.
hear from many women. I'll just use the example of mental health.
Yeah.
We have many patients within our platform and women that we support who, have been diagnosed with anxiety and depression, have been put on treatment that's specifically associated with mood disorders.
Hmm.
And the reality is there's a very strong correlation to estrogen, progesterone, and hormone health. And when they've been able to get access to prescription, those challenges that they've been, sort of experiencing or those symptoms have actually been largely eliminated, and they've been able to sort of remove themselves from that type of medication
Yeah.
just by doing, sort of a hormone replacement support.
Yeah,
Like
and it's
proper.
difficult too because a lot of these people, like say for cognition, for example, they'll go on a lot of these antidepressants, and they realize that maybe estrogen was the issue. Now
Exactly.
they just come off the antidepressant, maybe they get some withdrawal, and it's like there's so many other symptoms that you could be experiencing now just because you were addressing the wrong thing in the first place.
Absolutely. And I think it just reinforces the fact that, speaking to a trained expert and a specialist who really understands women's healthcare and hormonal health and these journeys
Hmm.
can make a dramatic difference, right? You can get very clear answers very quickly if you're speaking to the right, sort of level of practitioner who really understands these particular symptoms and this care journey.
For sure, and it not only impacts like the individual, but it also, it impacts the economy, right? Because women are more productive, they're working longer. Maybe if you could just touch on like the economic impact of treating menopause better.
Yeah, absolutely. I mean, in Canada alone, reports are indicating that menopause is basically there's a $3.5 billion impact on our economy due to untreated and sort of improperly cared for support during the menopause stage. And so I would say from an employer perspective as well, women not being able to access care readily and get these symptoms under control and really show up as their highest, performing, most productive selves in workplaces. There is a direct correlation to absenteeism, lost productivity, in some cases misuse of health benefit plans, right? Because
Hmm.
you're using those supports to cover the cost of providers who aren't necessarily specialized in providing appropriate treatment.
Hmm.
There's some really interesting and I would say discouraging stats that, we hope to be able to, sort of help to get around.
Yeah.
30% of women indicate that, these symptoms are so severe that they are passing up opportunities to progress within their careers. And in 10% of cases, so that's 1 in 10 women in midlife will leave the workforce as a
Yeah.
result of health challenges that they're experiencing in midlife.
That's crazy.
Mhm.
Oh my gosh. Yeah. No, that's insane. What does it look like? So somebody comes to June Health. Like what does the entire process look like?
Yeah, absolutely. So we are an entirely virtual care offering. And so our platform, as well as our health practitioners, are specialized and uniquely focused on women's healthcare. So we began our journey in building June Health, focused on midlife women's healthcare, perimenopause and menopause in particular.
Hmm.
We've readily expanded into areas such as weight management, women's mental health, for a lot of the reasons I just talked about.
Yeah. Yeah.
There's a lot of correlation in the care journeys and the symptoms. We also now support areas like endometriosis and PCOS, and you'll see us expanding into fertility and family planning throughout 2026 as well.
Yeah.
And so our objective is to continue to create an entirely specialized, focused platform to support the wide range of symptoms and care journeys that uniquely or disproportionately impact women.
That's a very good explanation. Yeah, it's everything that women need, right?
Absolutely.
No,
And
that's
we primarily sell to employers, so we do have a direct consumer option. So women can come into the platform and, independently access a membership and get access to the platform and our practitioners.
hmm
But our primary sort of go-to-market focus is to sell June Health to employers to add a women's health benefit as part of their comprehensive health benefit offering and
No,
really
that's
get
really,
at addressing some of the needs that we just touched on
yeah.
in terms of, the challenges that employers and workplaces face by women not having direct access to that specialized
Yeah.
support.
Do you think that a lot of kind of going back to the beginning of our conversation, but do a lot of women just suffer in silence because they don't know who to talk to, or they don't know where to go? Like, what do you think most women experience for that?
Absolutely. I think a lot of women suffer in silence, and I would say generationally, many women sort of, if you speak to your mom, that was sort of the experience of, the older generation was, this is just it's nature, it's sort of natural, we'll all go through it. You need to kind of grin and bear it, right?
Yeah.
So there definitely is a lot of suffering in silence. I would say there's also a lot of stigma and shame attached to really, surfacing all of these challenges that, women are having where they think it's just them,
Yeah.
right? So it's the suffer in silence, but it's also, we need to destigmatize conversations around things like menstrual irregularities and sexual health and reproductive health and, sleeplessness and fatigue. I think many women feel like they have to sort of be the caregivers for their family and, show up as strong, capable, effective individuals. I mean, that's not unique to women, but I think for
Hmm.
many women, it's, there's this almost shame or concern with surfacing like the weakness or vulnerability that perhaps comes with some of these health challenges.
Hmm.
And then I think the other piece of this is, and it goes back to, I think my experience is a really common one where women do go and speak to their primary care physician if they have access to one. And
Yeah.
in many cases, they're left feeling like they're not getting clear answers. There's this level of dismissiveness or gaslighting in some cases,
Yeah.
right? Where, there's a lot of correlation to maybe this is just stress or, perhaps you're not coping well to changes in your life or, perhaps you're not eating well or exercising enough. And, the patient or the woman themselves is thinking, okay, I haven't changed anything. I'm doing all the same thing,
Yeah.
right?
Yeah.
Some new symptoms.
Yeah. And I feel like, I guess this applies to guys too, but oftentimes, say the only thing you have close to you is a walk-in clinic. These doctors are seeing so many people each day, like they can't get to the root of your issue. They can't even ask like, "How are you doing?" Right?
Right.
And like, how do you expect to have a good relationship with the doctor and them really understand your problems?
And if you think about, yeah, it's a great point. And I would
Yeah.
say in Canada, and if you think about our Canadian healthcare system, there's the beauty of a publicly funded healthcare system and all the benefits that come along with it.
Hmm.
There are also some challenges, especially when you think about specialized care needs.
Yeah.
So, the fact that 1 in 4 Canadians don't have access to a family doctor or primary care practitioner is a challenge in and of itself. And then if you look at, the 3/4 of Canadians that do have a family physician, the sort of system is structured in such a way that you can book an appointment with your family physician, but in many cases, you can speak to one area of concern in that
Yeah.
appointment.
Yeah.
So if you have a myriad of new symptoms or issues that you're experiencing, it's really difficult to connect the dots, right? And have
Yeah.
a more of a holistic conversation about what you're experiencing when, that physician is effectively paid to support one issue during an
Hmm.
appointment.
Yeah, no, it's extremely frustrating, and yeah, the work that you guys are doing is incredible, and we'll cap our podcast there. But I really thank you for joining the podcast today, and I've learned a lot, and I'm sure our viewers will learn a lot as well. Thank you, Laurie.
Absolutely. Thanks for having me, Ben.